Our team at Compliance Mitigation wants to help people avoid government investigations and especially avoid charges for white-collar crime. And the way that we do that is by sharing this information about lessons we have learned through our other work, which is mitigation strategies. We work with law enforcement, with lawyers, helping people that face white-collar charges, helping them mitigate their sentences. I can't tell you how many people we meet every single day in our business who are facing criminal charges and the loss of liberty, even though they didn't know they were breaking a law. And at least that's what they're telling us. So what we want to do is create these case studies to help you and help other people understand how every single decision can either bring them more exposure to a government investigation or a crime. And today we're going to talk about one of those case studies. In this case, federal prosecutors recently indicted the owner and 2 employees of a Maryland pain management clinic, alleging it is a pill mill. The DEA heavily targets these so-called pill mills, defined as any healthcare provider's office, clinic, or healthcare facility that routinely prescribes and dispenses controlled substances outside the scope of professional practice and without a legitimate medical purpose. In this case, the government charges that defendants illegally prescribed and dispensed oxycodone. That is, they did it outside the scope of professional practice and without a legitimate medical purpose. To support these charges, the indictment relies on evidence that clinic owners prescribed oxycodone without a license. Oxycodone was prescribed to no-show patients. 3. Clinical employees conducted cursory medical examinations. 4. Medical records did not corroborate medical need for oxycodone. 5. Clinical employees increased patient dosages without medical justification, and employees falsified urine drug tests results for patients receiving oxycodone prescriptions. That's a lot of problems. Much of the evidence in this case was obtained by undercover agents posing as patients. If proven, these acts are serious violations of the Controlled Substances Act, and severe penalties follow for anyone that violates these laws. So what's the state of the industry? Well, the DEA continues to make headlines by raiding healthcare businesses, including pain management clinics. It also continues to go after individual physicians and other healthcare professionals who illegally prescribe opioids. The DEA's aggressive efforts to combat the opioid epidemic are poised to continue. Thus, healthcare providers dealing with controlled substances, doctors, physicians, physician's assistants, nurses, pharmacists, all of them face significant risks of investigation and prosecution. Now, unfortunately, this trend is unlikely to end anytime soon. The stakes have never been higher. Law enforcement has a zero tolerance for any business or individual facilitating the illegal distribution of prescription pain medications like oxycodone. Penalties will likely result in the loss of liberty. Importantly, doctors and other healthcare professionals even face the loss of their DEA licenses, which will severely hamper their ability to practice medicine. So what's the background and the analysis that our team has done? Well, this case study profiles a small Maryland pain management clinic that Joyce Edwards owned. It also involves 2 nurse practitioners that Edwards employed, Thomas Johnson and Justina Arboream. A federal grand jury charged all 3 individuals with 1 count of conspiracy to distribute oxycodone to patients without medical need. Oxycodone is a highly addictive narcotic subject to regulation under the CSA, the Controlled Substances Act. This indictment also charged each individual with distributing and dispensing oxycodone in violation of the CSA. According to the DEA, these defendants operated a pill mill. Pill mills are seemingly legitimate pain management clinics that regularly prescribe painkillers without any prior medical history, diagnosis, or documentation. According to the indictment, Johnson and Arboream are certified nurse practitioners. As licensed healthcare professionals, they could legally prescribe and dispense oxycodone and other controlled substances. The owner, Edwards, in contrast, has never been a medical doctor or a certified nurse practitioner. Thus, Edward lacked the appropriate credentials to legally dispense controlled substances. The government claims that Edwards prescribed oxycodone without a license and misrepresented herself as a nurse practitioner. When people misrepresent credentials, they expose themselves to problems with both civil and criminal law enforcement agencies. Also, Edwards routinely used blank oxycodone prescriptions pre-signed by Johnson and Arboream, also in violation of the Controlled Substances Act. Now, if this case goes to trial, prosecutors will present facts in an effort to persuade a jury or a judge to convict the defendants. If the case proceeds to a jury trial, prosecutors will present evidence to show that 1. Edwards prescribed oxycodone despite not having a license to prescribe medicine. 2. Clinical employees' medical examinations were cursory and incomplete. 3. The medical records did not support the need for treatment with oxycodone. 4. The clinical employees increased patient dosages without medical justification. And 5. Employees falsified urine drug tests that are required to make it easy to prescribe oxycodone. And the undercover agents who posed as patients to gather evidence of the defendant's business practices would likely testify at a trial. So defendants have the choice to enter into a plea agreement with the prosecution and avoid going to trial. But most people take a plea agreement like that, but they don't have to. They could also go to trial and have a jury of their peers listen to the evidence. Edwards, Johnson, and Aubrey faced the prospect of up to 40 years in prison based on the criminal statute. They also face significant legal fees, hefty fines, and penalties. And if convicted, a federal judge will consider findings in a pre-sentence investigation report and also the federal sentencing guidelines. The federal sentencing guidelines are not mandatory, but judges must use those guidelines as a starting point. Prosecutors may authorize or recommend lower prison sentences if the defendants cooperate. But if convicted, Edwards' pain management clinic will not reopen for business, and further, Johnson and Aubrey will likely lose their licenses to prescribe controlled substances under the Controlled Substances Act. So what are the recommendations that our team makes? Well, this case highlights the DEA's zero-tolerance policy toward businesses or individuals that facilitate the illegal distribution of controlled substances like oxycodone. For any person that violates the law, significant personal and financial consequences follow. Loss of personal freedom, time with family, and financial resources represent only part of the sanction because there's a lot of collateral consequences that will follow, such as lost earning power in the job market, difficulty in finding housing, difficulty in creating banking relationships, the inability to vote, the inability to use firearms or to hunt with guns. If facing any type of government investigation or prosecution, defendants should learn more about their options and consider crafting a mitigation strategy as early as possible. They need to help stakeholders understand more about their intentions, their character, and efforts to make things right. But what can we do as our team at Compliance Mitigation do to help businesses avoid this altogether? That's the really salient point here. Because we work with pharmacists and physicians and nurse practitioners routinely who are on their way to federal prison. And what do they all say? They didn't know. Well, ignorance of the law is not an excuse to break the law. And we believe that helping more individuals understand the complexities of government investigations and white-collar crime, we can help them think better. We can help them avoid a criminal indictment if those people can show that they had a good faith effort to abide by the law. So if you own a pain management clinic, if you are a physician, you need to really document your process for your business so that you stand a chance if you talk with a government investigator. You need to demonstrate that you're a good corporate citizen, and you need to demonstrate that you're training everybody on your team to operate in compliance with the law. In order to qualify for a deferred prosecution agreement or a non-prosecution agreement, a business owner and everybody that works in the business must be able to show that they had no knowledge, because the government could potentially charge somebody with something that's called willful blindness. That means you either knew or you should have known what was wrong. And so to create that record of events, you really need to develop a really transparent compliance program that you can use if you're ever confronted by either a civil or a criminal law enforcement agency. Now, if you're breaking the law, well, there's nothing that's going to help you except maybe God and perhaps a silver-tongued defense attorney. If you're charged, though, I really recommend you begin thinking as early as possible, how are you going to differentiate yourself from everybody else that faces these kinds of problems? Our team can help. My name is Michael Santos, and on behalf of everybody on our team at Compliance Mitigation, we want to thank you. Our motto, we did the time so you won't have to.